Let's see what happens. Too tight?
I am a storyteller.
Okay.
I'm an artist. I'm a healer. Doing art makes me feel alive. It makes me feel connected to myself, but also to the universe. I'm sitting in a wheelchair, not moving much all day, so when I get the chance to move, it makes something beautiful in the process. That's really good.
Lindsay Smith is 35 and has been living with the disease ALS since 2012. ALS is a neurodegenerative disease that affects the motor neurons. Over time, it leads to weakness in the muscles and eventually resulting in paralysis. There are around 30,000 people living with ALS in the U.S. Patients typically have about 2 to 5 years to live, and there is currently no cure for this disease. After decades of a lack of awareness and funding, ALS has seen a recent surge of interest. The combination of the social media campaign The Ice Bucket Challenge in 2014, the U.S. government's increased spending on medical research, and a new global approach to data collection has resulted in an acceleration in the development of treatments and potential cures.
The Ice Bucket Challenge really impacted the ALS community in so many different ways, and obviously the funding was the obvious one. But the other area that I like to bring up a lot is the awareness, which is essentially is priceless. We're still talking about it, and the number of people that are now familiar with Lou Gehrig's disease, ALS, is just it's phenomenal.
The Ice Bucket Challenge raised $115 million and resulted in funding for a series of research programs. The money from the challenge started the Center for Genomics and Neurodegenerative Disease at the New York Genome Center, and with the help of Dr. Hemali Phatnani, was able to find a new gene linked to ALS.
I'm Hemali Phatnani. I direct the Center for Genomics of Neurodegenerative Disease at the New York Genome Center.
Phatnani's lab studies genes and specific gene mutations that are found in ALS patients to better understand the disease and its pathways. Dr. Phatnani and her lab also created the Metronome, a database where ALS patient data can be shared across the world in real time. This is the first ever global approach to ALS research and provides a more in-depth analysis to understanding the disease.
But we also host the data in our in-house database, or data warehouse called Metronome. It's not just a warehouse, it also has a user interface that allows a user to interact with the data and visualize the data in many different ways across many dimensions.
The hope with this database is to have one central place where doctors and researchers studying ALS can go to share findings and communicate at a faster rate than ever before, hopefully leading to the creation of treatments at a much quicker rate. Despite the research field working as quickly as it can to provide these services to doctors and patients, there are still ALS patients today like Lindsay that are waiting for a treatment every day. The current treatments given to ALS patients is just not enough.
Her prescription meds are covered by insurance, but the rest of it is out of pocket. Yeah, it probably is over $500 a month. Lindsay's on Medicare and Medicaid. She has no income, and I'm on a fixed income. Like, yeah. She's her own person. So I try to help as much as I can, which is not enough.
The ALS Association says it can cost up to $200,000 annually for a person living with ALS to get the care, equipment, and treatments they need. Thanks to the Ice Bucket Challenge and the awareness it raised, it also led to a greater amount of funding as well. The National Institute of Health, which is the largest donor of ALS medical research, increased its spending from $39 million in 2013 to $55 million in 2017. This increase led to more research opportunities like Dr. Phatnani's lab, the National ALS Registry Project, the Department of Defense ALS Research Program, and others. According to the association, 67% of the dollars raised from the campaign went to research, while about 20% went to patient services. The financial support directly led to the creation of Dr. Phatnani's lab and the formation of the ALS Consortium. This is a global research group that meets every few months to discuss the latest in research. One of these groups is European-based Project Mine, who works closely with the New York Genome Center and Columbia University and was part of the new gene discovery just this year.
We've sequenced so far more than 2,500 ALS whole genomes, making this the largest ALS sequencing program in the United States, and the second largest in the world after Project Mine. And because we also make the data broadly available to other ALS research consortia. So we just jointly published a paper with the Project Mine group, where all of these data were analyzed together. We're not going to get much further with what we've already got. You need to be able to pool samples, pool data, and everybody needs to have access to this.
The efforts by Dr. Phatnani's lab show the ripple effects of the Ice Bucket Challenge dollars were put to work and able to significantly contribute to the disease. Because of the great understanding there is about ALS genetics and the new global approach to data, the ALS community is now able to perform a series of Phase 1 and Phase 2 clinical trials to test new drugs on ALS patients. This summer, Columbia University Medical Center, in partnership with several other research labs, will be testing a brand new drug on ALS patients. This study is funded by a biotechnology company called Biogen and is the first time patients will be tested with this new drug.
It's a really exciting moment in ALS research. It's true, I think, for all the neurodegenerative diseases, but I don't know, from where we sit, it seems particularly true for ALS. It'll take some time, I think, to get this right, but it's very exciting to be a real source of hope that we might be able to do something to influence the course of this disease.
I am curious about stem cell treatment. I'm hoping I'm really down for anything.